And we're live.
Hello, everyone. Welcome to our open house. This is Med Missionary Podcast, and we're just so excited that you're joining for an episode that is very important because it's an issue that many people are dealing with. And so we decided to bring it to the public to see if we can help you with this issue. So today we're going to be speaking about pain, management of pain with natural remedies. And this is based on the natural remedies that we have been using our lifestyle center, Yes Restore Lifestyle Center. And we try so many different things. And, every time we improving, we always pray because sometimes things don't work and we try different things. So we want to share with you what we have learned, and we hope that this is going to be a blessing for you. So I'm going to start with a word of prayer. Dear Heavenly Father, we thank you so much for your goodness. Thank you because you have the answers for the difficult things and for the impossible. And I just want to ask you that you bless us. And perhaps there is many people here that are suffering from pain. And I just want to ask you that you teach us and that the pain will be relieved, but not just the pain, but also everything, the spiritual life, the mental life, and the physical life. So I just want to ask you to please bless us as we do this program. In Jesus' name, amen. Okay, I'm going to share my PowerPoint. We're going to spend longer time in the practical part, but I'm going to also talk a little bit about pain. What is pain? And it's very important to know the types of pain, also to identify for us to do what is needed. See, I'm pressing here a slideshow, but it's not moving. Okay. So we are ready. If you have questions, please type I guess this is a YouTube program, so I'm gonna try to get in there so I can, when I see your questions, I can answer. Okay. Okay, so what is pain? What are the statistics? 29, more than 20% experience pain. And this is a statistics from 2021. And this is about more than 51 million people. And this is in United States. I was reading some study that says about 100 million people in the United States that suffer of pain. So this is very significant. A lot of people also are suffering from chronic pain, which is something that is, more than 6 months, more than 3 months, 3 to 6 months. And some people are suffering for years in pain.
And Mercy, if I can interrupt you, I don't know if your slides are showing. I think it's frozen on the screen where it showed all of your slides.
Let me do it again. See if this will help.
There you go.
Okay. Okay, let me see. Okay, so we're gonna go to the next part. A lot of the pain, it is the prevalence is in the back pain, is the back. So imagine 74.7% is in the back. And this is what we notice when people come to our lifestyle center. Most of people that come, not most of people, but maybe 40% of the people that come to LaSalle Center, they suffer of back pain. So we have to do treatments for back pain. And this has been more prevalent in the last couple of years, so maybe 2 to 3 years. A lot of people suffering of back pain. And also the other prevalent pains are degenerative spine disease. So this is related, I believe it's related to lifestyle because the way we eat and we are losing bone. So this is a degenerative spine disease and there's a lot of inflammation there. Also limb pain. So people are having surgeries of their joints, especially hip and knees. So this is very prevalent. I'm gonna go to the next one. Sorry, I'm having this problem. Okay, so what are the types of pain? We have chronic pain is short pain, not short pain, but it is only 6 months, the most minutes to 6 months. So this is an acute pain. But what we want to focus today is mainly on the chronic pain. So acute pain is going to be, of course, like cuts and burn and broken bones, something that happens suddenly. And so that's the acute pain. But chronic pain is what we're going to talk more about in this program. And this is one is lasts more than 3 months. So after 3 months, it becomes a chronic. And usually it can be arthritis, fibromyalgia, problems with the spine, joints, things like that. So then we have another pain is nociceptive pain. So this is pain caused by inflammation. The tissue is damaged, and it can be sharp, prickling, dull, aching. So I believe this is the more prevalent pain because it's going to affect also around the nerve pain, around the nerves. So the joint around the area, the soft tissues are going to be affected also. So this is caused usually by an infection, broken bones also, and osteoarthritis. Those are just examples of that. Neuropathic pain is another very common pain, and this is caused by, the central nervous system or the peripheral system that is affected. So it can be brain, spinal cord, peripheral nerves, and this can be like neuropathies, shingles, sciatica. A lot of people suffer lately of sciatica. And shingles too, and shingles is going to be more like chronic pain also. Some people suffer for many years. And of course, if diabetes is not going to be controlled, it's going to end up diabetic neuropathy. Very common. Now, there is another pain that's called psychogenic pain. It's in the absence of physical pathology. So we're going to see a little bit why this happens. And it is very, when they cannot find what the pain is coming from, it's usually psychogenic. Okay, just want to touch on cancer also. Why, what are the causes of pain in cancer? So, when the tumors grow, it's going to be pressuring the nerves. It could be pressuring the nerves, depending what it is, the cancer. And it's also invasion of tissues. So it's putting pressure into other tissues, and that causes pain. Also, there is a release of chemicals that is going to increase pain with cancer. And it's going to be because of the pressure in the blood vessels. Whatever cuts the blood pressures, the circulation of the blood is going to cause also pain because it's going to be lack of oxygen. Okay. This is very interesting that stress and pain. As you know, the endocrine system is responsible for making hormones. And so it can be also a release of the stress hormones, which is the cortisol, adrenaline. And this can, when it's a release of adrenaline, cortisol in the long term, is gonna create, it's gonna increase pain too. So it's gonna create pain. So it's gonna make it more intense. Um, if it's a lot of release of it, if it's a decrease, it's gonna be less intense. So it's very important to manage stress. So didn't realize that how important is pain related to stress. So if we're having a lot of pain, it could be also related to stress. So the stress, we have to learn how to manage the stress. And I'm just going to mention right now how to manage the stress because we're not going to be touching too much of this. And to manage stress, we do deep breathing exercises. This can stop or decrease the release of these hormones, which is the adrenaline and cortisol, which is released by the adrenal glands above the kidneys. So what we do is deep breathing exercises, and it's something so simple but so powerful. If you go into a lot of stress, what we need to do is know how to manage your stress. We might not be able to remove the stress factor, but we can be able to know how to manage the stress. So what we do is deep breathing exercises. We usually do 4 seconds inhalation, and then we hold it for 4 seconds, and we exhale for 6 seconds. Okay, so it's 4, 4, 6. So we have to be sure that we do this. So for patients that are very sick, pain, and they can be just stressed out just because they're having a lot of pain. So also pain can be causing more release of these hormones. So we have to, especially if we have a lot of pain, we need to do this. It's minimum when you get up, when you go sleep, after meals. My patients that are very sick, I tell them, do it every hour, 10 times at a time, 10 times at a time, every hour. But if you can do at least 4 times a day, 5 times a day, that will be wonderful. When you go for a walk, especially that do very deep breathing exercises, but especially when you wake up, when you go sleep, and after meals. Sometimes after meals, because it's going to help digest thing to
Sorry, guys. Looks like Mercy may be having a brief lapse with her internet. She should be back here in just a second. Just be patient with us. It's one of the things about living out in the country. Don't always have the most reliable internet. Okay, I think she's coming back. Looks like she's connecting. Yeah, her internet's back. We just need to finish connecting here. So just should be any minute now, any minute now. So appreciate your continued patience. Okay, I think she is back. All right, welcome back. And you're muted, Mercy.
Okay, really sorry for the disconnect here. So let me start slideshow again from the beginning. Okay, so let me quickly go back. Okay, so nociceptive pain is
And again, Mercy, we don't
okay,
see
we
this.
talk
We
about
don't see the slides. We just see the main
oh,
PowerPoint.
you don't see it? Okay, let me go back again. It seems that it takes 2 times to be able to get that. Okay. Okay, can we see it now?
Yes.
Okay, thank you. Okay, I think was okay, we went through the types of pain, neuropathic name, we talk about that, and psychogenic pain. Visceral pain is when the organs are affected. And it's deep pain, and it's squeezing, cramping. You know, the organs, when they're inflamed, are going to put pressure into the nerves also. So this is gonna cause pain. Also, the tissues that are damaged, releasing certain components is gonna be related to pain. Okay, we were on cancer actually. So for cancer pain, it was we talk about because it was the pressure of the on the nerves, invasion of the tissues, release chemicals and blockage of the vessels. Pain and stress. We talk about that the release of cortisol and adrenaline also will increase pain. So that is so important to do the deep breathing exercises. I found this very interesting because I've seen some people that having a lot of back pain and the smoking. So, and I found this, and there are several studies, and not just one. Nicotine and cigarettes cause blood vessels to constrict. So that way there's a low flow in the back, and it's going to decrease oxygen. And this is going to not to nurture the spine, you know, all that area. So no nutrients there, less circulation. So this is going to increase pain. So very important to stop smoking, if especially for back pain. Oh, here's another study. For current or and former smokers have a higher prevalence and incidence of low back pain. So I didn't know was a relationship with pain in the back, especially in smoking. Okay, so I just want to touch on what is epigenetics. Epigenetics is the study of the environment and behavior changes, how genes work. So that means that our lifestyle is going to determine how the genes work. And this is related to pain also. So in this study shows that applying the principles of epigenetic to pain management may significantly improve our current pain treatment regimen. So having a good lifestyle program in our lives is going to help us decrease the pain or eliminate the pain. Because, lifestyle is going to manage the genes. It can turn off genes, turn on genes. So you can stop the pain or not. This other study shows that lifestyle interference of gene expression are involved in the pathogenesis of several diseases and are gaining increased impetus in medical research, as they are also involved in pain processing. So the genes are involved in pain processing. Okay, so I just want to show you that it's very important having a good lifestyle in order to control pain. And we're going to talk a little bit about that. I found out this very, very good passage from Ministry of Healing. It says, those who seek healing by prayer should not neglect to make use of the remedial agencies within their reach. So we can pray and we can also do, apply the remedies that God has given us, right? It says here, it is not a denial of faith to use such remedies as God has provided to alleviate pain and to aid nature in her work of restoration. Because, sometimes we can say, maybe God wants me to have pain. I think we need to do everything humanly possible, apply the natural remedies that God has given us to relieve the pain, and pray that God leads us to that. And because God is, giving us these simple things for us to do all we can to avoid or to remove suffering. And here's another one. We should employ every facility for the restoration of health, taking every advantage possible, working in harmony with natural laws. That means that following the laws of health, because each law is very important to manage pain also, because the sun is going to decrease inflammation. Pain is a lot of inflammation. Most of the pain is going to be involved with inflammation. I won't say every one, but most of pain. So when we do exercise, there is studies that show that it's going to decrease the pain. Sun is going to decrease inflammation. The breathing exercise is going to bring more oxygenation to our tissues, helping. So all these laws of health are super important. Of course, anti-inflammatory foods. So lifestyle and pain. Lifestyle factors such as physical inactivity, sedentary behavior, stress, poor sleep, unhealthy diet, and smoking are associated with chronic pain severity. I put a study there. It's not showing. I put studies for everything that we done it, but it seems that the studies didn't go into the PowerPoint. But anyhow, so what do we do? I want to focus a little more into what is a practical thing to do to help with pain, decreasing. To me, I think we should do everything and anything possible to totally eliminate our pain. And we might not be able to do completely sometimes, but if we can manage and have a normal life, it'll be wonderful. But I've seen people with severe pain, chronic pain, that they do recover. Many people that they do recover, and that's what we need to try for that. So the diet is going to be important. So what we want to do with diet, we want it to be whole plant-based, because this is going to be anti-inflammatory. Whole plant-based diet is anti-inflammatory if we eat it healthy, whole plant-based, right? Not junk whole plant-based, because it can be adding oils, can be adding processed foods. It can be, it's like it's not refined, but it is, the way it's cooked is very unhealthy. So we wanted to be sure it's anti-inflammatory. So that means that it cannot be processed, because the processed foods is what is causing a lot of diseases. and it's going to bring a lot of inflammation and of course, pain. And the anti-inflammatory diet has to be balanced. So that means that you have to have certain servings of carbohydrates, certain servings of fat, certain servings of protein, certain servings of fat. So it has to have a balance. It cannot be just, oh, I'm going to eat a smoothie for breakfast, so I'm going to eat just a juice for lunch. So it has to have all these factors in order to be a balanced diet. Now, I found some studies that shows that garlic is very good to decrease pain, especially the visceral pain. That means the deep pain of the organ pain. So I will eat a healthy diet, and I will, eat garlic also. Usually what we do is 2 cloves of garlic with 1 tablespoon of lemon juice and 4 ounces of water. So you blend it. I'm going to repeat it again. 2 cloves of garlic with 1 tablespoon of lemon juice and 4 ounces of water. You blend it, and you can drink that with meals. So if you're in pain, I will do this until the pain is totally gone, following everything else that we're going to talk today. So that's a super great recipe that's going to build your immune system. It's going to decrease inflammation. It's antioxidant. It does many, many things. It's going to help with cancer. All these things are related to pain. So I will do that every day. Another thing that we can do is take turmeric every day. And there's many, many studies. I'm just showing you one study of each one because I want to focus also on other natural remedies. So the curcumin is anti-inflammatory, anti-nociceptive, that means anti-pain, antioxidant. So, this turmeric is super amazing for pain. It is not like taking a pill. You take a pill, okay, in 30 minutes, the pain is gone. This is going to take probably about 2 weeks. It's a loading dose, 2 weeks. And then after that, usually the pain is gone or is decreased. So we want to do that. We do it 2 teaspoons a day, and we want to mix it with milk, with coconut milk. Usually that's what we do, but you can mix it with any fat, whatever way you can drink it. But we do it with fat. Is much better absorbed. So you want to do it with fat. Okay, so that's another natural remedy to do. Ginger is really great for pain too. According to this study, it says was traditionally was used as a pain reliever for dysmenorrhea. That means cramping pain when you in your period. But also it says here osteoarthritis, chronic low back pain, and migraine headache. So ginger is very good. What we do for the ginger, we just slice the ginger, about 1 inch of ginger, and you boil it with about 3 cups of water. You can put a little honey if you want. It's super tasty. And we do it 3 times a week. We don't overdo it because it's stimulatory. So we don't want to do it too much. So we do that 3 times a week. So that's another thing to do for pain. And this study for the limonene, this is the orange or lemon peel. The orange seems to be stronger than the lemon peel. It tastes better too. So just a piece of orange peel, you can just throw it into your smoothie. Be sure it's organic. Doesn't have pesticides, and that should help. It's super good for neurological conditions. You really want to do this every day because it's going to decrease inflammation. It's good for cancer, all these causes of pain. So that was the title actually of the study. The limonene exhibits superior anti-hyperalgic effects in a B-cytrodextrin complex form in chronic muscular pain. Okay, so the study they did in muscular pain. Okay, so yeah, there's many studies. I just pick up this one. Okay, we're gonna do now the very, very practical things that we do for pain. And this is gonna be, what can I do for migraine headache, for example? I have many people, every program I have, 1 or 2 people have migraine headaches. And this is usually because they're drinking coffee. So when they come to the lifestyle center, we don't serve coffee. So we had to do something. And this treatment almost always help. Maybe I would say 95% of the time help. If it's not helping, it's because they let it go for so long, or they've been in migraine medications for so long, and so they need a little longer time to be helped. So maybe in 5 days, this might help, but almost always it helps, even in even with chronic migraine. So what we do is, in 5 gallons bucket, we have them put the legs there, and we fill it up with warm water, as warm as they can tolerate. And then we put a cold towel in the head. And we try to have them be relaxed in a recliner chair. And I cover with the towel the eyes, because they sensitive to light and to noises, when you have a migraine headache. Because if you don't do this, the headaches can get worse. So I had one lady I was helping, and the pain wasn't being relieved, and people were talking while she's doing the treatment. And then I came and I see that, and how's the pain? Oh no, it's not better. Okay, let's go to another room. I mean, it's not gonna help if it's a lot of light and people talking, and it causes more pain. So it has to be in an environment that is a little relaxing. I will do deep breathing exercises while I'm doing this too, because that will increase the speed of relieving the pain. Okay, here's another natural remedy for pain. Sciatica pain is so common. Almost every program we do, we have a person that have sciatica, 1 or 2 people that have sciatic pain. This is super, super common. We just trying to help, help you with the most common pains. So this is what we do in same over 90% of the times that when we do this, it works. Maybe almost 100%, because it's almost everybody. I think I had one person, I was having a hard time. We had to try different things, and finally we were able to help. But this natural mix is very amazing. So we mix 6 tablespoons of clay with 2 tablespoons of flaxseed, and then we put water as needed. What you want to create is a paste. You really want to create a paste, because you have to spread it into a paper towel. So it's going to be a long one, folded in 2, and you just put it on top. The whole, what do you call it? Mixture. You spread it. Sometimes I just put a glove and spread it with my hand, because it's so easy that way, because it takes a while to put it with a spoon. And we usually use a wooden spoon or plastic spoon, because we're not supposed to use metal. And spread it, and then we put present seal and just tape it in the back. So the way I place it is, because the pain is coming from the spine that's pinching, right? So what we have to do is this position. So you put it this way, diagonal toward the pain. And so it's a long paper, right? So we cover it up that area and we tape it. And so this has been the most amazing therapy for sciatica. And sometimes for upper back pain too. It depends exactly if it's the muscles what is hurting the most in the joint, or it is the nerve. If it's the nerve, usually the clay is what is gonna work. But if it's not the pinching nerve, but it's the muscle perhaps around it, so we do something different. We had to try different things till we find what works. But I'm just explaining to you that this is what has worked the best. Okay, for upper back pain, what we have done is hydrotherapy first, and then we do ginger poultice. So hydrotherapy, everything we do is very simple. Anybody can do it because, God doesn't want to give us things that are so complicated, machines, anything like that. It's very, very simple that any person, any place in the world can do it. So what we do is I bring a pot of hot water, boiling water with a cover, and then another pot, put it next to it. So what I do, I grab a towel from the corner, and I have gloves, and put the towel into the water and then remove it into the other bowl, and I close this. And the reason I do that, I want to keep this hot for as long as I can, so I don't have to go back and forth to the kitchen. And then I wring it out on my other bowl, and then I test it on my arm. I want to be sure I don't burn them. Test it. So if I can, if it's okay in my arm, I put it immediately into the back in the area that's painful, and then cover with that towel. And excuse me. And I do that continuously until the pain is really down. So it doesn't take that long. So I usually ask them, okay, how's the pain from 0 to 10? And they tell me it's 8. It was 10. So, some people are really in a lot of pain. Some people are crying in pain. Okay, 8. Okay, in another 5 minutes, I ask again, how's the pain from 0 to 10? Oh, it's 6. Usually. Another 5 minutes, usually 4. Another 5 minutes, usually 2. Okay, 2 is good. I can be another 5 minutes and make it 0 maybe, but 2 is good. People having a lot of pain, 2 is nothing for them. So after it's 2, usually what I do is I put ginger poultice. So what we do is I shredded ginger, and then and put it between 2 paper towel like this, and then put it in the area, cover it up with press seal, tape it there. Whatever way you can tape it. One time, one lady was having, she couldn't tolerate the press seal, the plastic, so we had to put paper tape, just paper, a bunch of paper tapes. It worked. So you have to do whatever it takes. So this worked really, really well for upper back pain, because the reason I realized after doing these studies is because increases circulation and keeps the heat. So after you do that, after doing the heat towels, I really quick do it with a friction with a cold towel, just to keep the heat in place. And then I put the ginger poultice. And these people sleep all night long. And then the next day they say, oh, I sleep well all night, because poor people, they're in pain all night. They cannot sleep, and they're pain 24 hours. It's very sad. And they're in a very strong medication, and nothing is working. So these are things you can do. But I just want to emphasize that it's so important to change your diet, do a very anti-inflammatory diet, because you have to remove inflammation. If you keep putting in inflammatory foods, you just kind of like relieving the pain for a short time. Okay, then visceral pain, what do we do for pain, organs pain? So what we do is charcoal poultice, 6 tablespoons charcoal, 2 tablespoons of flaxseed, and water as needed, and you make exactly the same, a little kind of creamy, not running component, and then you spread it into the paper towel, and then do the same thing, put in whatever organ the pain is happening. And then what do you do for a joint and muscle pain? For joint and muscle pain, we usually do potato poultice. So what we do with potato is we shred the potato, and then we press the potato with your hands, get rid of the liquid, and then you put it in the paper towel, and then place it in the area and just tape it with press and seal, or however you want to tape it. So that's very good poultice for decreasing swelling. If you have an injury, it's good to put ice on top of the poultice for the first 24 hours. And the swelling is going to go really down very quick. Very amazing poultice, especially for injuries. For arthritis also is good. But I like this is my newest poultice, thanks God, because we're praying one time because this guy, nothing was helping. So I tried this with a lady first and then with a guy that was both having kind of, I think it was arthritis pain. So we try 1 tablespoon turmeric. That's a superfood, super anti-inflammatory. 1 tablespoon of orange peel is another super healing anti-inflammatory food. And then we did 1 tablespoon of flaxseed, which is an anti-inflammatory omega, right? So I mix those three and then put a little water as needed and mix it up and spread it in a paper, put it in the arm. It took 20 minutes for the lady to relieve the pain. And then I went to the guy, I put it to the guy almost at the same time because I want to know if this really works, because it can work in one person, but if it's only one person, it's not good enough for me. So I went to ask the guy, how's the pain? The pain was also almost gone. So this is one of the most powerful poultices that we do. This will be for pain and probably muscle pain, tissue pain, joint pain. I will try that. So another thing for cancer, what we like to do is we put onion poultice. If it's breast cancer, we put onion. Usually shrinks the tumor. You have to be super consistent with this, and you have to follow good protocol for cancer, right? Very important too. The natural remedies do nothing if you don't change your lifestyle. I mean, they can help you for the moment, but we want it to be lasting. So we just put the onion layer and put it in the area, whatever it is, on the breast or whatever it is. Onion is good for also injuries. You just put it in there, wrap it up, put ice on top, wrap it up again. That works also. Then we have the mixed poultice that we already talked about, the orange peel with the turmeric and the flaxseed. That's a mixed poultice. It's very good for cancer pain, because what we want to do is decrease inflammation, decrease shrinking the tumor. So that will be those anti-cancer super healing foods that you can put it directly also in the skin. And I done that for liver tumors, and you can do for whatever tumors. Put it on top of the skin. I like all the poultices to be directly to the skin, nothing between, directly into the skin. The only one that we don't is the ginger, because the ginger, it can burn a little bit. So that's the only one we don't do directly. And then also charcoal poultice, we put it for cancer pain. So, you can do in the morning one, at night the other one. You want to take 1 hour break so the skin won't get so weak. So it'll be 23 hours of poultices of some type. I will try even all of them, 8 hours one, 8 hours the other one. Or you can just pick up one and do it, morning and evening, and then see what is working. Because if the doctors are checking CRP, usually they check every week for cancer. If the inflammation is decreasing, that means that, this might be working. So, keep doing whatever is working. So this is very, very, very handy. All these poultices are very simple. I'm going to answer a few of the questions. I think we are... Non-diabetic neuropathy pain. Okay, non-diabetic neuropathy pain. Okay, I will do, I will do clay. Try the clay poultice that we talked. By the way, this video, you can see it over and over. It's going to be left on YouTube, so you can see it again if you need to make notes. Let's see if I have more questions. What is an alternative for turmeric if someone has a sensitivity to it? So, turmeric is good to take it every day, but if they're sensitive, don't worry about it. Just do the rest. You can keep doing the flaxseed, do the orange powder that we do it every day. So what else? The onion and the garlic, all those are anti-cancer and anti-inflammatories for whatever disease. So just do that. You will be just not doing one, but you will be doing all the other ones. We do the garlic and onion broths and all that, and you can do that. What will be best for trigeminal neuralgia? I have not had a person that came to our center with neuralgia, trigeminal neuralgia, I will do, based on the treatments I've done before, I will do both. I will try the clay to see if that helps. If that doesn't help, I will try the heat, the hydrotherapy with heat, and then put the ginger poultice and see how it works. So I will try every poultice that we talk about it here. But, the inflammation has to be removed and the diet has to change also. So I will try everything that we talked today. Achy pain, okay, I think we talked about back pain already. Bentonite clay will be a good option for clay. Any clay will work, but bentonite is what we've been using. Green clay will be good too. Can you use charcoal and castor oil together in the same poultice for abdominal pain? I will not mix it, because otherwise you stop the effects of the castor oil with the charcoal. Is gonna pull that, and so it's not gonna let it release. So I would not mix those two. So if I understand, you do not use turmeric, orange, flaxseed in a paper towel. Yeah, we do mix the turmeric, orange peel, and the flaxseed in a bowl. So what we do in a bowl, you put 1 tablespoon of each one. And if it's a big area, you can put 2 tablespoons of each one. And then you added water and mix it, and then spread it in the paper. And then I usually put it in the bottom. I put the present seal, and then on top I put the paper that is spread with the mixture, and then I just grab it and put it whatever area needs to be put on. Okay, so very good questions. So I just want to let you know, we're coming up, we are going to have a new class for Med Missionary in August 31st. So this is coming up. By the way, we're going to have graduation this Sunday at 7 o'clock Pacific time. You can join us. Very good testimonies we're going to have there. Anybody is welcome to join. It's going to be here in this channel, Med Missionary channel. And here we have the class for the next time, August 31st. And you can just go to medmissionary.com and sign up. There we're going to teach you how to eat to heal, how to eat to decrease inflammation. We're going to teach you exactly what diet you need to eat. We're not going to give you recipes or just tell you this is good, and it's going to be a menu, a exact menu how to eat. And you're going to have the protocol with these super healing foods to be incorporated throughout the day, how to incorporate it, all the recipes, all that is in there is all the basics for you to recover in a very, very practical way. Because, information is not as great as practicality. You need to learn what is the practical thing. So we have that program coming. If you're dealing with cancer, we highly recommend you to sign up. If you're in pain, you have been in pain with chronic pain, we recommend you to join. If you're having any type of inflammation, this program will help you. If you're having also any type of disease and need to decrease inflammation, we will teach you step by step how to incorporate the whole program, because we have the classes are live every Sunday for 6 Sundays. The program is open for 8 weeks, and there's so much information in the website that you have to very rich information, how to prepare the meals, how to do natural remedies with videos. A lot of the information I shared today is going to be in videos. So there is a very, people, when they sign up, they give us a super great reviews, and we're so grateful to God that we can serve, we can help relieve the pain, and also train, because we want to train you to recover and train you to help other people. That's why it's called med missionaries, the medical missionary work God has given us, for all of us to help others. So I just want to encourage you to join. Let me see if there is any other question. Okay, I think, are you the person in the United States that does the med missionary training? No, the med missionary training, we have several doctors that come. This coming program, we're gonna have Dr. Ugana Woods. She's a pediatrician. She will be doing the health evaluation class. The second and third class usually is done by Dr. Josh. The third and fourth class usually is done by Dr. RV. She's internal medicine doctor, and she does the natural remedy class and also the difficult condition class. And the last class is done by Dr. Shea and myself about how to become a coach, or how to help other people. So, I'm involved in every program and just answering questions. So whenever I'm needed, but we have a good amount of physicians that are so dedicated to, to train people throughout the world. This is a program that we've been doing for several years, and it's a global program. So I think most of countries of the world have been taking this program. If we have not, just let us know. We happy to add it. But if you go to medmissionary.com, if you see the list, those are all the countries that we serve, and we include all the countries of the world. So I would love you to join, and we love you to help you with whatever conditions you might be dealing with, and also give you a support in your journey. Most importantly, we do these programs because as Jesus came to this world to relieve the pain of these people that are suffering, we just want to follow Jesus and help people with the suffering they're dealing with. And pain is one of the big ones. So we like to help you. So I hope this program was very helpful for you. And I hope to see you again. Hope to see you August 31st. Try to apply these programs, these natural remedies at home, and hope that it's going to help you. I'm going to finish with a word of prayer. This is my little granddaughters trained to be a medical missionary, but now we're going to pray. Okay. Dear Heavenly Father, we thank you so much for all the blessings, and just want to ask you that perhaps people that listen to this program can follow some of these simple things that we talk, and they can find relief of their some of the problems they're dealing with. And I just want to ask you, perhaps if they can join, that you provide what is needed for them to join the program, that will provide the whole, it's a whole program. So please continue guiding us and leading us, continue teaching us more and more. We know that the situation is more and more difficult in regard of health in this world. There's the science advancing, but diseases are getting worse. So we really need your help to continue instructing us. And thank you, because even these simple things are so incredible. And thank you for giving us the blueprint to recover too. And I just want to ask you special blessings for everybody who has joined tonight. In Jesus' name, amen. God bless everybody. Take care. We'll see you next time.